Welcome to our channel, everyone. Today, in honor of World Cancer Day, we're talking about a subject that's close to all of our hearts: cancer awareness. We all know someone who has been affected by this disease, and it's crucial to remember that early detection is often the key to successful treatment. So let's dive right in and discuss some of the warning signs you should never ignore. Remember, knowledge is power, and by being proactive about our health, we're taking a stand against cancer. Have you noticed your clothes fitting looser lately, even though you haven't made any changes to your diet or exercise routine? Unexplained weight loss can be a sign of several health issues, and yes, that includes cancer. We're not talking about dropping a pound or two. We're talking about a significant unintentional drop in weight, like 5% of your body weight or more. This could be a red flag for cancers like those affecting the stomach, lungs, or pancreas, which can disrupt your metabolism and appetite. Now, don't panic if you've lost a few pounds, especially if you've been more active or made healthier food choices. But if the scale keeps going down without a good reason, it's definitely time to schedule a visit with your doctor. They can help figure out what's going on and ease your mind. We all feel tired from time to time, right? But when fatigue becomes your new normal and you're constantly feeling drained, even after a good night's sleep, it's time to pay attention. This type of persistent fatigue, the kind that disrupts your daily life and makes it hard to function, can be a symptom of several cancers, including leukemia and colon cancer. These cancers can affect your body's ability to produce red blood cells, which carry oxygen throughout your body. Without enough healthy red blood cells, your body is starved for oxygen, leaving you feeling exhausted and weak. So if you're battling constant fatigue that just won't quit, don't dismiss it. Talk to your doctor. They can run some tests and help you get to the bottom of it. Pain is our body's way of telling us something's wrong, right? While occasional aches and pains are a part of life, chronic pain, especially pain that lingers for weeks or months, should never be ignored. This type of persistent pain, particularly in the bones or other specific areas, can be a sign of cancer. For instance, bone pain can be a symptom of cancers that have spread to the bones, while persistent headaches may indicate a brain tumor. Now, I know pain can be subjective and difficult to describe, but if you're experiencing any unusual or persistent pain, don't hesitate to reach out to your healthcare provider. They can help determine the cause and recommend the best course of action. Our skin is a window into our overall health, and any changes in its appearance could be a sign of something deeper going on. When it comes to cancer, keep a close eye out for new moles, sores that refuse to heal, or any unusual changes in the color or texture of your skin. For example, a new mole that's asymmetrical, has irregular borders, or has changed color could be a sign of skin cancer. Jaundice, a yellowing of the skin and eyes, can be a symptom of cancers affecting the liver, pancreas, or gallbladder. Remember, early detection is key when it comes to skin cancer, so if you notice anything suspicious, don't hesitate to schedule a visit with a dermatologist. We've all experienced a cough or hoarseness when we have a cold, but what happens when it just won't go away? A persistent cough that lingers for weeks, especially if it's accompanied by coughing up blood, should never be ignored. Similarly, hoarseness that lasts for an extended period, especially if you're not a smoker, can be a red flag. These symptoms can be indicative of cancers affecting the lungs or throat. For instance, a persistent cough can be a symptom of lung cancer, while hoarseness can be a sign of laryngeal or voice box cancer. If you're experiencing either of these symptoms, it's crucial to consult with your doctor to rule out any serious underlying conditions. Bleeding is never normal, especially when it occurs in places or at times when it shouldn't. If you notice blood in your stool, urine, or vomit, or if you experience unusual vaginal bleeding, it's crucial to seek medical attention immediately. These types of bleeding can be signs of various cancers. For example, blood in the stool can indicate colorectal cancer, while blood in the urine can be a symptom of bladder or kidney cancer. Unusual vaginal bleeding can be a sign of cervical or uterine cancer. Remember, anytime you experience unusual bleeding, it's essential to get it checked out by a medical professional. Our bodies are constantly changing, and while most of these changes are perfectly normal, some can be warning signs of something more serious. One such sign is the appearance of new lumps or thickened areas under the skin. While not all lumps are cancerous, some can be early indicators of cancer, particularly breast cancer. It's crucial to perform regular self-exams and be familiar with the normal look and feel of your breasts. If you notice any new lumps, bumps, or any changes in size or shape, it's essential to schedule an appointment with your doctor for a proper evaluation. Difficulty swallowing. When eating becomes a struggle. Eating should be an enjoyable experience, but for some, it can become a struggle due to difficulty swallowing, also known as dysphagia. While occasional difficulty swallowing can be caused by a number of factors such as a cold or GERD, persistent difficulty swallowing, especially if it's accompanied by pain or weight loss, can be a red flag for cancer. This symptom can be a sign of cancers affecting the esophagus, throat, or stomach. These cancers can cause narrowing or blockages in the digestive tract, making it difficult for food and liquids to pass through. If you're experiencing persistent difficulty swallowing, don't ignore it. Consult with your doctor to determine the cause and discuss treatment options. Changes in bowel or bladder habits. Pay attention to what's normal for you. We all have our own unique bathroom routines, but when those routines change suddenly and persistently, it's important to take note. Changes in bowel habits, such as persistent constipation or diarrhea, blood in the stool, or a change in stool consistency, can be signs of colorectal cancer. Similarly, changes in bladder habits, such as increased frequency, urgency, or pain during urination, blood in the urine, or difficulty starting or stopping urination, can be indicative of bladder cancer. If you experience any of these changes, don't hesitate to reach out to your healthcare provider for a proper diagnosis and treatment plan. Persistent indigestion or discomfort after eating, when heartburn isn't just heartburn. We've all experienced indigestion at some point, often after a particularly large or spicy meal. But when indigestion becomes a regular occurrence, or if you experience persistent discomfort or pain after eating, it's time to pay attention. These symptoms can be signs of stomach or esophageal cancer. For example, persistent indigestion that's not relieved by antacids, feeling full quickly after eating small amounts of food, or experiencing pain or burning in the chest or upper abdomen after eating can be red flags. If you're experiencing any of these symptoms, don't ignore them. Talk to your doctor. They can help determine the cause and recommend the best course of action. Outro: be proactive. Knowledge is power. Remember, early detection is key when it comes to cancer. By being aware of the potential warning signs and seeking medical attention promptly if you experience any of them, you're taking a proactive approach to your health. Of course, it's important to remember that experiencing one or more of these symptoms doesn't automatically mean you have cancer. Many of these symptoms can be caused by other, less serious conditions. However, it's always better to err on the side of caution and consult with your healthcare provider to rule out anything serious. Don't forget to like this video and subscribe to our channel for more informative health tips. And please share this video with your friends and family. You never know who might benefit from this information. Together, let's raise awareness and fight back against cancer.